Hello, this is Dr. Luke Rebnich, and this is how I perform the SMILE procedure at ClearSight Center in Oklahoma City. So we begin by accurvating upon the eye, as opposed to applanation, which is how most femtosecond lasers are applied. Centration is important. It's critical to avoid high-order aberrations. It's less important in myopic treatments, but as we proceed to astigmatism and hyperopia will become of the utmost importance. The posterior cut is performed first. This is the refractive cut. The side cut is then performed, followed by an anterior cut. The laser process takes somewhere between 30 and 35 seconds typically. The side cut is completed, and that is the end of the laser portion. The patient is then shifted back, and the lenticule is removed as so. I start with an anterior dissection across the first 90 degrees, or across all 90 degrees. I then do a posterior dissection of half of the side cut, or about 45 degrees. I then do a full anterior dissection in the anterior plane. I begin centrally and move peripherally. The anterior dissection is typically fairly straightforward. The tissue bridges are not very strong. The posterior dissection is typically more difficult with stronger tissue bridges. This will require more effort and will also allow you to know that you are in the correct plane. Now this is very important. You want to start centrally and move peripherally. And I leave 2 anchor points at 3 and 9 o'clock to assist with this posterior dissection. It is it can be easy to have retained lenticule. This is typically the result of aggressive dissection or not going from center to periphery. That is more common in a lesser treatment, and as the lenticule will be thinner. The lenticule is then removed with a forceps. It is important to be certain that the lenticule has been fully dissected. It should be easily removed, and if not, for the dissection will be indicated. Especially when beginning, it is important to determine that the lenticule is complete. And I confirm it 2 ways. Number 1, I look at the lenticule on the surface of the cornea. And later I check with the slit lamp. Not everyone irrigates, but I do, to remove any potential debris. I'm using BSS. And then I treat the cap similar to a LASIK flap. I use wet and dry wax to remove any potential striae. Of course, it's less important or less common with SMILE, but striae still can exist. And this is very similar to what an upside-down LASIK flap would appear like. Here is that second confirmation that the lenticule was fully removed. I then apply an antibiotic and a steroid 4 times a day for a week with the first drops here. I use a 4th generation fluoroquinolone, as well as predacetate or predforte 4 times a day. This was a very happy patient on day 1, seeing better than 20/20 with both eyes together, and still very happy. Thank you.